this pandemic represents a challenge for everybody, and especially institutional leaders like you guys. Now, I say pandemic and survival. You all say what?
Well, I definitely agree with you. It's pandemic and survival. You know, this pandemic has really changed the way we do things. And it's definitely made us a lot more aware and a lot more creative in the way we function every day. So it's just been a challenge. Definitely been a challenge.
And that's very true, but one of the things I really like to emphasize is that the sheriff and I were able to step out early on with preparedness for the pandemic. Some people probably even raised their eyebrows at us, wondering why we were stockpiling PPE equipment and going to all of the local stores and working with the store managers.
Right?
Yes.
Yeah, you're definitely right about that, dog. You don't think back.
Yeah, at the end of December, January, we had begun meeting. And strategizing as to some of the kinds of things that we would need to do, not knowing how serious this would get. But Sheriff Brunson, having been the school safety officer for years in the school system, and now the sheriff, preparing for events, whether it was active shooter or what have you, had just always been a natural part of our relationship. And so that just continued as we found out more information about the pandemic. And so if he got to a resource or supplies, he would call and say, Doc, the board may want to look at getting this extra kind of supply in so that you'll be prepared if something happens, because I think this is going to get big. And I would call him and say, Sheriff, I just went to a meeting out in California. Their news is reporting something different from what we're reporting here, and we need to get ready. And so we got together in early January and started writing on boards and making plans and looking at the supplies and kinds of things we needed to get in. And so we were able to handle some things early on before the governor and the state superintendent even came in and said to shut down. We met with our custodial staff, retrained them, told them what to wipe down, how to keep the building sanitized, and we were wearing masks long before the CDC recommended that we wear masks, because we had a conversation about common sense. If we wear masks to prevent influenza, certainly we should wear a mask to prevent COVID-19. Of course, we didn't realize on the back end that the CDC and the healthcare profession was running low on supplies, which was part of the order, that citizens not really take on wearing masks. But we started out early with masks and giving masks to our staff members and things like that. And I think that helped us to mitigate a lot of the spread in our agencies here.
Definitely. It definitely did, Doc. And just thinking back, I can remember, we meeting at the Dollar General, meeting at Walmart to buy supplies and stock up on supplies. And like you said, way back in January, we had already strategized what we were going to do, thinking and trying to be proactive. So it didn't hit us as hard because we were already prepared. And it's always good to be proactive. And definitely I love working with Dr. Brooks. She's she loves this community just like I do, and we always think about what if. And it's always been like that. What if, as we work with the kids in the community way back when I was, security, we would go out and look for kids and try to help the community, man. It's definitely been an experience with this COVID along with that, though, but it's been good.
The state and federal government.
Governor Ivey has been doing a good job, keeping us informed and trying to, keeping up with the safe at home orders. And still trying to keep some form of normality here, whether it's going to school, whether it's doing it, over the way that they are doing it. I think she's doing a good job. I know we just got a bunch of supplies through I guess, her office and through ADECA that's really helped. I think they're doing a lot for everybody. seeing what we've been getting and staying abreast of what's going on, I agree with what's going on. I think they've done a good job.
Well, at the state level, I actually commend Governor Ivey because she stepped away from what some of the other southern governors were doing. Alabama has a mask mandate. Georgia, Florida, some of the other states did not go that route. And I believe that she has been under immense pressure from some of her constituents to relax some standards and to be more expedient in the relaxation of some of the orders than what she has been. And so I think she has done probably as well as she could do under the circumstances with the pressures that are on her back to stand tall and steadfast in saying in Alabama, we are going to keep these orders in place. And I pray that we continue to keep this mask order in place for a while longer, because if we were to go away from it now, I just believe it would be disastrous for Alabamians. We have enough people who we have to struggle with wearing PPE anyway. And if the order goes out of the window, I just think it's going to be doomed for Alabama. So I think she's done a magnificent job in keeping some of these orders in place when you look at other states and they have not done so. And I believe it was Georgia where even there was a dispute between the governor and the mayor about trying to put in an order that was designed for the safety of the people, which I just could not understand. So I'm proud that Governor Ivey stood strong and is standing strong in that regard. From the federal government, I was glad that there was a bipartisan effort to go ahead and get some COVID relief funds in our hands. Does it go far enough? No, because I see that we may still have needs in terms of PPE, internet connectivity, and those kinds of things well into fall and maybe even winter of 2021, a year from now. And so these funds are going to run out. So I'm hoping that December and January will bring us some new pots of funding, because our regular funding that we get does not include any line items for PPE and those kinds of things that we're going to need continuously. And I also hope that both our federal and state government from a school system standpoint will find the dollars without cutting any other funds for us to have after school, Saturday school, Sunday school if we need it, and summer school extended learning day for every kid without having to write a grant or be in competition with any other system. We can make up this lost learning time. We just need to put the resources out there to do it.
The adult community.
The adult community. Well, I guess that's kind of twofold. The adult community, we all kind of don't want to see change, and right now what we are doing is change. We can't go out and do the things that we used to do. We can't go out and do the things that we always want to do, because of COVID-19. We want to go to the stores without a mask. We want to go around the lake and party. We want to go do all these things. We still want to get together, but we just can't do it. And for me, and I'm not going to say it's been a headache, but we have to deal with grown folks saying they do what they want to do. And that's not the way it should be right now. This pandemic is dangerous. It's killing people. And we're trying to keep our community safe. So the grown folks are being a little rebellious sometimes. On the most part, a lot of people are doing what they want to do. People know that it's serious, but it's the grown folks who are not taking it as serious. And we got to have them to do so. We just can't go anywhere and not have a mask on. We are risking our families. We are risking bringing COVID-19 back home to our grandmothers, our grandfathers, our kids. And it's the grown folks that's doing it. So we got to be more adult about it and do what is required to keep everybody safe.
Well, I look at human behavior, and, we learn that cigarettes cause cancer. And you see folks still puffing away. We learn that seatbelts save lives. And we see folks, I know the sheriff does, just driving on the interstate, no seatbelt
No
on.
seatbelt,
And so this mask goes with the same thing, human behavior. We have a tendency to engage in those practices that are not in our own best interest. But where COVID differs is if you smoke that cigarette, you might affect yourself in a small circle. Even with the seatbelt, you may cause an accident for yourself and maybe a few other people on the interstate. But with COVID, you're talking about a spread that goes so quickly, you can infect hundreds and thousands of one bad decision. One bad decision, one exposure, one encounter. The best example I've heard is the glitter example. You give one kid glitter, how many kids in the classroom will have glitter on them at the end of the day?
Right.
The whole class is littered in glitter. As you go down the hall, the glitter just spreads. Everybody in the building has glitter on by the end of the day. You take the glitter home. The glitters are stuck to the school bus. Grandma's got glitter on her. The cat has glitter on him. And so that's what happens with COVID. It spreads just that quickly. So even though human behavior causes us a lot of times to do things that are not in our best interest, we've got to make a better effort with COVID to do those things, as Dr. Maxwell Stafford said last night. We've got to look at the greater good. We've got to go beyond ourselves and look at our children, as the sheriff said, our families, our communities, our grandparents, and those kinds of things. But the adults, and I understand it because I am too, are fatigued from COVID. We thought it would last 30 days, 60 days, 90 days, 6 months, and we're coming upon a year now. And so people are fatigued, but we must continue to stay vigilant. We see a lot of people, they wear the mask under their nose, they have the mask down here, it's swinging off the side of their ear, they take it off to talk. And so it's almost like anything I can do to get out of this mask, even though I'm trying to convince myself I'm being compliant, I'm not. Because if you wear it under your nose emits droplets. And you're in the store just spreading droplets all over the store, but you say, oh, I have my mask on, but it's under your nose. No, you don't have your mask on properly.
Right.
And then when you take your mask off, you just can't throw it anywhere. It says lay your mask on a clean surface and take it off your ears, lay it down. When you put it on, pick it back up by the edges and put it back on your face. It doesn't hurt you to spray it with a little alcohol while you lay it down so that it can be sanitized. Those are the kinds of things we have to deliberately and intentionally do. And I know it's hard. I know we get tired of it. But I would rather do that than to continue to see people have to go in ICU, continue to see people with long-term effects of COVID, and we don't even know what they are yet, and to see the fatality rates that we're having. I just lost 2 colleagues in Montgomery County Public Schools. Several people passed over the weekend from COVID-19.
Sure.
The youth community.
Well, actually, I want to commend the youth, especially those little people, those pre-K, K, 1, 2, and 3. You got to come and take some film of them. They are little soldiers. They wear their masks. They have them in all kinds. Spider-Man, Wonder Woman, Princess Tiana, Cinderella, you name it. They wear their face shields on top of their masks. And they love the sanitizing machine. Can I get some more sanitizer? So our younger children are doing a beautiful job. We have to make sure, though, what we expect at school is the same thing that is being practiced at home. And so that's why I say to parents, don't let school be the first place they wear a mask and put on a mask. Let them know when they go out, when they do things at home, they also have to do it so they'll be accustomed to it. Now, the older the children get, the more adult-like the behaviors become. We had our seniors in, we've had our 10th graders in, all the way down to K for various things. And we can see the difference based on age. I can see it in my own children. I have a 2nd grader and a 9th grader. My second grader is religious about his mask. If you don't make him pull it off, he'll sleep in it. My ninth grader, it's hot, Mama. I can't breathe. Well, you're not going to breathe when you're on that ventilator. Get that mask up.
That's right.
So I'm on her daddy's on her, you're going to wear your mask. And so I'm more fearful of her being in a setting when she's away from me, because I know she'll let her guard down and she'll pick up the behaviors of what's being supported around her with her peers. And those teenagers are rebellious by nature. If you say go left,
They want to go right.
there's a pit you're going to fall off. On the right, guess which way they going to go? They're going to go right and look over in there to see if there's really a pit. And they may go fast enough that they just fall on in the pit. So we've got to understand that teenage mindset, rebellious by nature. Be home at 10 o'clock. Well, I just step in at 10:02 just to see what Mama's going to say. That type of thing. But the little kids are great.
Yeah, definitely. I agree with what Doc said. You know, and definitely, I have a 5-year-old grandson, and it's more like it's part of his life. You know, he likes the math, he likes the learning. You know, he likes the at-home learning. But my 9th grade 14-year-olds who are classmates with Dr. Brooks' daughter, it's the same way. You know, they are more rebellious because they're used to, this is something they have to get used to, wearing a mask and different things like that. They wasn't brought up like that. The 5-year-old is part of life to him now. Mm-hmm. But to them, they're rebellious about that mask. They don't want to wear a mask. They don't want to do the homeschool, and they'd rather be at school with their friends without the mask and try to make it every day. But things have changed. But it is definitely much easier with the younger people than it is with the older people.
That devastating pandemic.
Wow. It has definitely been devastating. You know, all over the world, all over the U.S., it has definitely been devastating. You know, but now, if we're talking about now, it's getting even more devastating. And I think people, and as Doc spoke earlier, people are getting tired of wearing the mask. People are getting tired of being at home. People want to do what they want to do. And now it's at an all-time high because of people doing what they want to do. You know, it has been devastating. It's going to continue to be devastating unless we do what it takes to curb this COVID-19. You know, devastating is a devastating word. And that's what we are facing right now, just plain devastation. Unless we can do something to stop it, it's going to continue to be this way.
And I tell you, the thing that I see that is the most devastating right now is that the environment or the climate has changed, so to speak. Meaning that in the spring and in the summer and the fall, those were situations that were conducive for outdoor events. So graduation, Sheriff Brunson managed graduation for us at both schools. But we were outside, we were on the football field. You know, the risk was lower. And so we didn't have any cases that we know of that popped up from those events, directly from those events. Then we went on into the summer. Again, you can go to a park, you can do certain things, you know, outside.
And
some sense of normalcy.
Out of sight.
Halloween, drive-through, nice weather,
Yes.
you know, that type of thing. But I think one of the things that is making this more devastating right now, well, really two things. One is we're in the nostalgic time period. Thanksgiving and Christmas. Those are the most traditional times of the year. That's when you get together. You eat mama's pie, chocolate cake, you exchange gifts. You just get together during those times. And so for us to think about not getting together with the people we love, I mean, that's like anti-humanistic to us.
Yes.
And a hard construct, you know. And especially if you have an older relative, a parent, you're weighing it. Well, I might not see them again anyway. Look at their age. You know, do I run the risk? So you've got that is a nostalgic period. But now we got to be indoors. We got to be in the house, in the gym. It's too cold to be outside having the outside church services. You know, 28 degrees. Now a lot of people are going to be outside for a whole lot of things. So now you've taken a devastating pandemic, and because of the environmental factors, it's even more devastating. So how do we use our creativity now, like we use for Healthy Halloween and drive-through food giveaways, now that we're indoors? And people still have that quest for us to have some creativity to make these things happen, because we found a way to make them happen ever since the spring, the summer, and even up to Healthy Halloween. But now we're challenged because what creative activity do we come up with? What do we do? How are you creative inside of a gym? Those kinds of things. So that's where I see the devastating issue being now, and more impacting as a devastating pandemic, because it threatens our sense of normalcy even more than it has in the past.
Definitely.
Hope.
We have hope. We have hope, and I have hope every day when I get to come to work. I hear Dr. Brooks come up with all these great ideas. We wouldn't even thought our kids would have had a very safe and happy Halloween, as we just mentioned. It's people that think like Dr. Brooks that gives me hope, that gives us hope. People that care about this community that gives me hope. Definitely, the community should know the thought, the preparedness, and the things that go into feeding these kids every day. And I know these kids not coming to school, some of them wouldn't even get a meal if it wasn't for what Dr. Brooks have put together. That should give everybody hope. Amen. It's just been tremendous to see the people, even in the community, that have these meetings every Saturday, every Wednesday, every Friday. They don't know what goes into trying to keep them safe, keep them fed, keep this community running. That always gives me hope every time I get up on Saturday morning and have to get with this meeting with the people, and the people in the community, the leaders in the community that are trying to have hope for this community. Definitely we have hope, and that gives me hope every day. It's just people like Dr. Brooks, and I won't name all the other people, but I can say people like you who are always here, always lending a hand, always out here thinking about what's going on, and people don't even know that. But that always gives me hope, and if people knew in the community, that should give them hope too.
I would definitely concur. I would say the collaboration of the citizenry and the leaders in Macon County gives me hope. As I said earlier, if the sheriff knows of a resource or has a resource, he's going to share it, whether it's taking PPE equipment to agency in one of our governments, is sharing it with the school system, it's telling us where we can get something. It's you and the other persons who have communication tools being open and willing to help us get important messaging out to the community. It's all of those leaders who come together to help us make the plans, look at the plans, review the plans, look at the best practices. So there is a lot of, as Sheriff Brunson said, a lot of work going on behind the scenes to try to mitigate COVID and to try to give our citizens as much normalcy as possible. I mean, there's a whole committee of people who work on getting food from food banks and having a schedule and setting up giveaways. There are still forums going on. The AIDS World Day Forum. We've learned how to use Zoom. People from anywhere from age 2 all the way up to one of our leading citizens in the community who's well into the 80s. I mean, using all of these technologies that we didn't think we would embrace before. And we're all embracing them, and we're all utilizing them. And the creativity gives me hope. No, we can't do it the way we used to do it.
Right.
What can we do? And we figure it out. We figure out a way to do it and to bring it. But outside of our community, I'll tell you what gives me hope. I was talking to one of my coworkers, and she has a daughter who is in Barbados. Mm-hmm. And I was talking to someone else who's in Dubai. And I'm looking at all of these other communities that are predominantly black and brown like our community is, and how they have mitigated COVID-19 and the freedoms that they're able to have because they have taken this pandemic seriously. And so my hope is that if we take this pandemic seriously, like those communities that are models, and they don't get a lot of news coverage, especially from national news, because they're in direct contrast to what we've done in this country. and they have been able to mitigate and basically have no cases
Wow.
of COVID-19 in those places.
Right.
And I'm just in awe of how they prepared, attacked, and mitigated this deadly disease. So I am hopeful, especially coming into January, that we will take a similar approach in our country then and with any future epidemic or pandemic that comes our way.